Good day to all of you. So today I want to talk to you about um, rapidly because I want to have my clips for about 5 minutes or less. So today I want to talk about the um, the diagnosis of bipolar. That is also a word that is used quite often by friends, relatives, uh, family members, and we're not quite sure about what that means. But we tend to use it um, quite frequently without really knowing what it means. So bipolar disorder, what really means is the shift of moods from one extreme to the other extreme. So that is bipolar. It goes from one polar to the other polar. So meaning that they might be very happy and then very sad, very rapid or fast, and it doesn't make sense. Nothing has happened to cause those elements. And there are different types of bipolar. There is the bipolar 1, the bipolar 2, rapid cycling. We also have the cyclothymic disorder, and then we had the bipolar with mixed features. So we have a variety of different types of bipolar, but the most important thing that I want to say today is that bipolar is a mental disorder like schizophrenia or like another severe mental health disorder that might need psychotropic medications to help them, in addition to counseling, to help the patient cope with that disorder and to remain in remission. And the patient needs to be alert and aware about the symptoms. And but I think the most important thing is to be able to understand that bipolar disorder, it really doesn't mean that the person is crazy. I don't like to use that word, but it's a word that is used frequently by many fellow citizens. And I think we need to understand that bipolar is a disorder that happens in the brain, where the individual might go from a really high to then a depressed mood, and it doesn't make sense to the patient. Could trigger thoughts of trying to kill themselves because it's hard to cope. How I was very high, I was in a manic episode, a burst of energy. I could conquer the world. I could do all these plans. I could build a house. I could build a building. I could get a master's and a doctorate program. Then after that, I could become a doctor, then a lawyer. I could raise all my kids. To then a place where nothing matters. I cannot accomplish anything. Life is awful. I'm worthless. And so going from those highs to those lows really fast, and it doesn't make sense. So bipolar is a disorder, and people need to avoid using them unless you are a mental health provider who understands and is able to educate the patient about bipolar disorder, and is able to provide assistance to the patient who is suffering from that condition, to understand how bipolar is a medical condition that is to be treated very successfully, as long as the patient follows the regimen and follows the recommendations given by the psychiatrist and by the psychotherapist, to keep them in check and to help them to cope with that debilitating mental health condition. So do not use bipolar disorder so freely if you are not a mental health provider, and try to understand that bipolar disorder is a condition that might be very scary, difficult to understand, and for the patient who suffers bipolarism, sometimes it doesn't make sense, and life is out of control because the mind is out of control. If you have more questions, please visit my website, which is www.counselingbyroberto.com. And you can ask me more questions about bipolar or bipolar disorder, about any of the different types of bipolar that they are there, and I'll be more than happy to help you to understand what's going on, and to provide you additional information and education about this important topic. Until next time, be good, be blessed, be kind, and treat other people with respect and compassion. Until next time.